If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I was in a car accident and I had a fractured jaw.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
It looks natural, it feels natural.
It's more affordable.
Very affordable. It's well worth it.
It doesn't hurt.
What pain.
Now I can chew like real people.
I don't have to put all the goo on.
With these, I can eat everything.
I don't have to worry about being embarrassed going to a restaurant.
I wish I would have got it done a long time ago.
It's the best decision I ever made.
It hasn't made my life easier, it sure has.
Mini dental implants have changed my life.
I feel a lot more confident, my smile feels better.
They gave me my dignity back.
It's been fantastic.
It's been wonderful.
Now I have my smile back, and that's really nice.
It's just so much better.
I do smile a lot now.
My dental implant has changed my life.
I'm excited to be me again.
Well, now I don't have to worry about it. I can laugh however I want to.
I love it.
Welcome to Innovations in Health. I'm John DeSciullo, welcoming Dr. Victor Apel. Doctor, welcome to the show.
Thank you so much, John.
We are going to talk about a life-changing procedure, the mini dental implant. So whether you're in Melbourne, Florida, the Barrier Islands, from Vero to Cocoa Beach, you want to pay attention because you are going to get your life back. Dr. Apel, the mini dental implant is going to change your look, change your life. It's going to change the way you feel. And imagine, everybody, biting into that juicy steak, biting into that luscious apple, and when you go to the seafood festivals here in Florida, you can enjoy that ear of corn. Dr. Apel,
Exactly.
Everything is going to come back.
Exactly.
Dr. Apel, we have some models here, and let's start with the first one because this represents a more traditional, conventional implant.
Yes, this is a model that shows bone structure, and this right here is the traditional implant. You can see the size of that. You have to have a certain size of bone to make that actually happen. And next to it right here is the mini dental implant preparation when we place that in there to stabilize or to place a crown.
A much smaller hole in the mini dental implant versus the conventional.
Very much so, less invasive.
Absolutely. And you have another example of an upper denture.
Yeah, this right here is a model that shows an upper denture, a little hard to get off, and you'll see that we have 6 mini implants right here, but look at this denture. You can see how this palate is all cut out here. All this is here so a person can actually feel that food in the roof of the mouth. They can also feel temperature, which gives a more natural sensation there.
And that mini dental implant on the upper denture is very important because it stabilizes, but that sense of taste, so somebody that hasn't had that for a while, that sort of suffered the consequences of having an upper denture, now they're going to get everything back that they had before.
Exactly, that's what we hear.
I'll take this away and we can show the lower denture example.
This lower denture right in here, which is where we have most of our problems with people because they have their tongue in down there and they have to keep things to hold it in. This has 4 implants, and this denture right in here actually snaps right in place. No more goop with that. It helps to stabilize that denture for the patient.
You said something very important, no more goop. So imagine, folks, you have all that adhesive, the lower denture just kind of rocks and rolls over the gum. The goop is gone. The titanium post holds it in place. So the titanium post is my thumb, and the denture is now affixed, so it's not going to move. You're not going to have that fear that your teeth are going to fall out. You blow out candles at your birthday party or at your child's birthday party or your grandchild's birthday party, and it's not going to happen anymore.
No, they have confidence.
That's an important point. All right, so that's a lower example. I'm going to take that, and we'll have another one that you can show.
This right here is what we call the Fix on 6. We have 6 implants put in here, but you'll see this is made out of a zirconia material, and in here are inserts. So this is what we would have to place in there, and the patient wouldn't take this out. Okay, it's kind of semi-permanent. It stays in, and we would remove it for them at least twice a year, but that goes in and snaps in place.
And that looks terrific. And these are made in America products, everybody, and the teeth are made right here in the USA. The titanium posts are made in the USA, and it's an important point to make because you are really getting your look back. So I'm going to take this away, Doc, and we're going to take a look at another example. This is almost as if God has given us a 3rd set of teeth.
Exactly, John. This is something that's actually permanent. And in this situation, we actually will place in 10 to 12 implants, okay? This is a zirconia material which will be close to exactly what you had before. This is permanent. You don't take this out. This is cemented in place, and this becomes a part of you. You don't take it out if you go any place relative to a hospital and they say you need to remove anything. No, it's part of you now.
And what's important to note, Dr. Apel, is this is something that will happen in your office. This is a procedure that can happen in one day. So if you go to 1514 South Babcock Street in Melbourne and you call the number to find out more, 321-233-3360, and online at melbournefloridadental.com, you'll find out all about it. It's in the office. So this procedure is going to be in and out. It seems almost hard to believe.
It's revolutionary. I tell you, it's been exciting for us to bring this to the patients that we have in Melbourne and surrounding areas.
And now we're going to show an example if you have just a few teeth that need to be fixed or a single tooth. Show us that.
Yeah, you know, I got into it because of the stabilization of the dentures, but what it can do for people is replace even teeth in the posterior segment. So like in this example right here, we have implants placed, and this has the crowns that are actually cemented right in place. They don't come out, they stay in. You take care of them just like your natural teeth. And in this area up in the front where we have a single tooth, anybody out there have a flipper? Okay, something that you worn for an injury? This right here is a tooth that's been missing. So what you would do is we would have a mini implant placed, the crown would be cemented in place, and that's it. It stays in.
And these teeth are constructed exactly to fit the patient's mouth.
That is correct.
This is not a cookie cutter procedure. This is something that's specific to the actual patient.
That's right, John.
And on the side teeth, you know, a lot of people might say, well, it's in the back of my mouth, nobody's going to see it. No, it's important because that's where you chew. That's where all the nutrients from the food that you eat come from. And your teeth could cluster, your mouth might misshape if you don't get it fixed.
That's what most people don't understand. Proper mastication gives you the proper nutrients, okay, to give the body what it needs to grow and stay healthy. And I tell you, we found that that works best because if we don't get it and we do have shifting in the back, it can change the joint position and other health issues.
So just when you're thinking, well, you know, it's more of a cosmetic treatment, no, it's much more than a cosmetic treatment. And let's show that single tooth again, Doc, because if somebody has a sports injury or they've been in a car accident or there's something that might have happened to them and a tooth or two get knocked out, you can be of any age, more or less, to get a mini dental implant if everything's going to work right.
That's correct.
Yeah. All right, you know, mini dental implants, folks, they're 5 times less. They're less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. They're FDA approved. And, you know, Dr. Apel, we're going to get to know you in just a little bit, but I have to ask, when you were introduced to the mini dental implant, because you've been a dentist for a while,
yes,
what was your first reaction?
I was amazed. I was amazed at the simplicity of the procedure and the convertibility of it to where we can move from one procedure to another as far as appliance or restoration. And the time that it takes to get it done, it's just the best thing that I've ever seen. I've done conventional implants for years, but this totally has revolutionized our practice.
Well, let's get to know you a little bit. We talked about that. Where did you grow up and where did you go to dental school?
I grew up in Louisville, Kentucky, and it was wonderful. I had the 4 seasons there, but I tell you, the winters were tough. And you being down here now and enjoying this weather, you know what I'm talking about.
I do.
The climate down there kept us to move down here.
And with your dental education, you know, you got going at a time when the technology was not as advanced as it is right now. So talk to me about how the dental technology has advanced since you started your practice.
Oh, that's going back, John. But I will say that I have seen many changes, and all of them have helped to bring a higher quality of care for our patients. So I was with analog everything. So patient charts, we've gone digital, and we now have a scan unit for CAT scan for our patients. And so we can really plan these cases out and deliver the best care.
Is that the cone beam that
is
we're
correct.
talking about? And you should discuss the cone beam because people that go in for the mini dental implant or any other dental procedure, this is an advanced piece of technology so they could really take a look in a 3-dimensional way about what's happening in your mouth.
That's exactly right. That scan allows us to take slices through there and determine the quality of the bone, the availability of bone, see if you're a candidate for this incredible procedure with the mini implants. Yeah. So it's been really something. And
your family's here in Florida. You've made Florida your home now for decades.
Yes.
And we like to say that, Dr. Apel, you are designing smiles.
Yes, we are.
Yeah. Talk to me about that because it's an interesting line that you have on your website at melbournefloridadental.com.
Well, it started years ago when we were taking a look and a lot of aesthetic procedures were coming out. And what I kind of found out is I had a knack, a little artistic ability, and that led itself to a lot of cases where we were really doing new smiles for people. with veneers and crowns and incorporating that. A lot of education with some of the leading practitioners in the country gave us that, and that's when I came up with Designing Smiles, and that's what we do.
And whether, as we said, whether you're in Melbourne, Florida, from Vero to Cocoa Beach, the Barrier Islands, you want to look your best. But a mini dental implant is not just a cosmetic piece. This is something that will make your mouth feel better, will give you that full set of teeth, will help you be healthier.
Hello, I'm Dr. Victor Apel. Welcome to Designing Smiles, a mini dental implant center of America.
At Designing Smiles, Dr. Apel uses a modern, gentle approach to dentistry. By bringing affordable mini dental implants to Melbourne and the surrounding communities, he's changing the lives of his patients who suffer from loose dentures or missing teeth.
With mini dental implants, you can be you again. Call us today for a free consultation and give us the opportunity to change your life. It helps people get their life back. They get their self-esteem back.
Yeah, they can be themselves again.
That's right.
On your website at melbournefloridadental.com, you talk about some of the other dental procedures that you offer. What are they?
We do a wide variety of family dentistry, from fillings to crowns, root canals. We pretty much take care of everybody's needs. And now with the encompassing of the mini implants, we can pretty much take care of anybody.
So if you're out there and you have a dentist already and you're thinking about a mini dental implant, or you're watching us now and you're pondering whether or not this is what you want to pursue, Dr. Victor Apel can do that, and other dental procedures. And it's 1514 South Babcock Street, Melbourne, Florida. You're not far from anywhere.
No.
You're right there, right in the heart of it, right on the water.
Yes, we are.
Yeah, so you get this beautiful view, and we can't get enough of it. Let's talk about your staff. You have a great team in place. I
am really fortunate to have the people that I've had. Assistant's been with me for 15 years, and we're rebuilding on our other places, but the dynamics and the personalities that we have, I'm very, very pleased with.
Yeah, and the team you have will work with the patient, and you will offer a free consultation. So what would you discuss with someone when they come in?
I always like to determine, what are their needs? What are their perceived goals? And so once I understand that, then we can look at the clinical, what they have going on in their mouth, and determine what the options are for them, and discuss that with them, and the staff will help them work that into their budget. And that's important that you mentioned budget, because you want to make this affordable. And folks, if you're out there and you're thinking, well, I can't afford this, remember, the mini dental implant, 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive than those old conventional implants. And you will work with the patient so that on a monthly basis, they're making that investment in themselves and in their health. That is correct.
It's good to know. And you have a team and they're ready to sit down and uncomplicate that.
Yes.
Yeah. One of the things that conventional implants, in the old days, they used to take a long, long time, with the way things worked with the bone. Explain again with the timetable. You have a free consultation, you make a determination, and how long then from that consultation to the mini dental implant completion? Well, I'll tell you, John, depends on what they have going on, but if they come in, say a tooth is missing, they come in and we're able to do a scan on it. At the next visit, we can place that implant and the crown in the same visit. So it's that fast? Yes. Yeah, that's what makes the mini dental implant so revolutionary. And one of the things that you have to take a look at, folks, if you're in a relationship, you're getting a new job, there's something changing in your life, no matter what your age, you could be a senior citizen and you want to have that renewed sense of vigor, this is something that you should do. And if you're out there watching and you're thinking about it, you need to pick up the phone and call 321-233-3360. Dr. Apel, you have a great team ready to answer the phone, right? Yes, we do. You do. And here in Florida, life on the ocean, you want to feel your best, you want to look your best. And talk to me about some of your patients, some of the testimonials from the people who've come in from here in Florida, who've gotten not only the mini dental implant, but other dental work. Yeah, I tell you, I have patients that are always commenting about our exam that we do. They go, I've never had anything that's been so thorough. I had a patient the other day that had an upper denture, and he could not, if he yawned, it fell down on him. Couldn't laugh, so it was anything that he opened really wide. Well, we performed the mini implants for him, and he couldn't be happier. He's just singing the praises. He said he can do anything now. It's totally secure. And so those are the kind of things that the minis have really brought to us. And talk to me about some of the other patients too, because I'm sure you have young patients and middle-aged and older patients. Everybody has a different story to tell. Everybody has a different dental issue that they're dealing with. But I've had some dental work done myself, and after you get it done, I have to tell you folks, there is that uplift that you feel because you're more confident in your smile. Talk to us about what some of the patients have said about that.
You know, everybody's on a journey, and everybody has a story to tell. I'm on my 3rd generation as far as treating patients down in Florida. So the people that have had children who've now had children. So the little ones I get a joy out of when they come in, and we're able to make it a pain-free and an enjoyable experience. They actually like coming in. Other people who have had problems with, a tough time in their life, have not been able to really take care of them the way they would like to. When we've restored their mouth, whether it's crowns, veneers, they light up. And that is our true reward.
So they've gotten over the initial, I don't say fear of going to the dentist.
Yeah.
It seems so old school to say that, but people still do have a fear of going to the dentist. Why is
yes,
that, Dr.
they do.
Apel?
It's probably different for different people. Some of it's a bad experience sometimes. Other ones are something that they've heard. But any of those things, I have found it's real for them. And those are the things that we look for. So we always let them know that they're in control. And once we work through that and they trust us and they understand we're here to help them, then it usually works out pretty well.
So once somebody gets the mini dental implant and they've gone through this procedure, how do they take care of their teeth? We showed in the models, which we'll show in just a little bit again, what you can do, but what would be the average way that a person can keep control of what they've got?
Well, you take care of those just like you would your natural teeth. If you're doing it as far as crowns, you brush and floss like you normally would. The other appliance, the Fix-on-6 or the full roundhouse, those would be done with a type of irrigating device, but cleaned also.
Yeah, so that's just an average way of keeping clean, but you got to do it.
Yes, you do.
You have to come back to see Dr. Apel and his team to get that little checkup every once in a while. We should all get a dental checkup, by the way. These are made in America products, everybody. The porcelain, these are teeth that'll take a licking and keep on ticking, as they used to say, and the titanium post holds it right in place, so you're going to have that stabilization. And when people say it's less pain, it really truly is. What would be an over-the-counter medication that someone would take after getting a mini dental implant?
Usually what we find is Advil seems to work pretty well, but whatever works for that patient, whether it's Tylenol, but that's pretty much what we have.
Yeah. So just, a little bit of pain, but just so much less than what you would have experienced in an old-fashioned conventional way.
Very much so.
Yeah.
What pain.
It's actually really painless.
He had the implants in before I knew it.
It was totally painless.
I didn't have any pain.
No pain whatsoever.
It didn't hurt.
I never felt a thing.
They're yet to hurt me.
There was no pain, no discomfort.
I would refer Dr. Apel to family and friends, and I do.
We talked about care and we talked about going to the dentist. So if you're out there and you're thinking, oh, I have a dentist already, that's okay. I'm glad you go to the dentist. But if you want the mini dental implant procedure from the mini dental implant specialist here in Florida, you want to go see Dr. Victor Apel, 1514 South Babcock Street, Melbourne, Florida. Here's the number, 321-233-3360, and the website is melbournefloridadental.com. Now, Doc, what we talked about is we're going to show these models once again because I think now that someone's watched for the last 30 minutes, they're going to say, all right, now I sort of get what they're talking about. So again, show us what that means, that mandible and the conventional versus the new mini.
This right here is a mandible that shows a traditional, older style, the size of that compared to a mini dental implant. And you can see that it's less invasive.
And what is that example again?
This is an upper denture stabilized by mini dental implants, and you can see that the palate, the roof of the mouth is all cut out so that you can actually feel that food and taste that food a lot better.
And what's important to note, everybody, again, if you're suffering with a denture and you can't taste the food that you're used to tasting, the fact that that upper denture and the palate is removed, show it to us one more time, because you can now, if you're going to all these seafood festivals here in Florida, you want to eat that ear of corn, you can bite right into it. First of all, you're going to taste it. Secondly, you're not going to have the fear that your denture is going to fall out or that you're going to have a problem with your teeth, and it snaps right in place. It's just amazing. We have another example. This would be, I guess, the lower, right?
That is correct, yes. There's our lower there. You can see that. We have 4 mini implants there, and the denture actually snaps right in there.
And again, no more goop. Listen to that snap. No more goop, everybody. So if you have the denture and it's rolling around on your gum, and you know what's awful about the goop, Dr. Apel? You listen to people say, oh, I'm swallowing it and I can't stand the taste anymore.
Yeah, that's why there's so many products on the market, is because they're still trying to figure out something that tastes good and works good, and not going to happen.
So let's show that lower again, because again, you take it off, and the titanium posts make the stabilization possible. And there it is. And listen to that snap. Right into place, and that's a lower denture. Now we're going to show another example, the fixed on 6. And why do they call it the fixed on 6, Dr. Apel?
Well, we have 6 implants in here, and the housings in there actually will allow that to snap in place, and this is removed by us. You come in and we'll actually remove that. So we call this semi-permanent.
So explain again the fixed on 6 and what that means as an example.
Fix on 6 is where 6 implants are placed, and this bridge right in here, which is made out of a zirconium material or plastic, depending on if there's any plastic that's needed to come up at the gum line, and that is actually placed in. We would remove it for you a couple of times a year, make sure the O-rings are in good shape to keep that fit proper.
And when you say O-rings, take that set of teeth off and we'll show the camera what that O-ring means, because those are the posts. The posts are fixed to those O-rings inside the set of teeth, and that's what makes that stabilization possible.
That's right.
If somebody comes to you, Dr. Apel, and says, all right, you're going to put the titanium post in my gum, but maybe they don't feel like they have enough bone, or they maybe feel like this isn't going to work, how do you allay their fears?
Well, what we do is we would have a consultation, and we would do a scan, okay, cone beam scan, and determine the amount of bone that they have and the placement of those mini implants for stabilization.
So what I'm told the word is osseointegration, where the titanium post goes into the bone, and the bone will actually then grow around it so that it will stabilize internally, just as nature would make its course.
Yes, and that's the thing about the mini implants is actually in placing those, they're osteostabilized immediately on placement. So that's how we can do the same day, placing in the crowns or stabilizing a denture in the same day.
Yeah, and we have another example. This is as if you're going to get a third set of teeth.
Yeah, this is the Cadillac. This is as good as it gets. These are just like your natural teeth as far as the sensation and the feel. We place more implants in there for actual support, and those could be 10 to 12. And then a zirconia bridge is actually fabricated, custom, that actually fits over those, is cemented in place, and becomes a part of you.
So that really is the highest end you can get. So as we've discussed now in this program, this is the mini dental implant, but this is a full set of teeth that one would get.
This is a full set.
Yeah, and it's cemented right in place.
Yes.
Now, if somebody has something in the back, they might have something going on, this, again, is the example on how you can get a mini dental implant.
Yeah, right here, you can see in the back area here, these were missing teeth and mini implants were placed there, and these crowns are actually fabricated and cemented right into place, and they become just like your natural teeth.
Do you see many cases where people have problems with teeth in the back, 1 or 2?
Oh yeah, and the conventional one was actually to go through and whittle down the adjacent teeth, but to me that's making a 3-tooth problem a 5-tooth problem.
Mm-hmm.
So we can actually replace those without affecting the adjacent teeth, and that's just a much better service.
And if somebody doesn't get the mini dental implant procedure or doesn't deal with the problem with those back teeth, talk to us again about what that might mean.
Well, there can be a lot of change that can occur in the bite itself. The teeth can actually shift. They can shift in that area itself because they fall over. Think of like books on a shelf, and you pull one out and they kind of fall over. It's the same thing can happen in the mouth. The other is the opposing teeth, the teeth on the other arch can actually begin to grow. This can throw the bite off, which can create interferences, which can create issues with the joint itself.
I've read where your heart health, your whole body is so impacted by your dental health.
Yes.
Talk to us about that, because people tend to forget that what goes in is what helps the whole system.
You're exactly right. There's a reason the Mayo Clinic said that oral health, good oral health, can add 10 years to your life. That has to do with actually nutrition through masticator, chewing the food. But also I think it has to do with the person's self-esteem, how they feel about themselves because they're taking care of themselves. They also say, the mouth is a mirror to the health.
Yeah, I've heard of that.
Yeah. And
if someone has a single tooth, now here in Florida, a lot of water sports, people are doing a lot of activity outside, and I'll ask you to share a patient story or two along the way, but show us a single tooth again, because this is amazing.
Yeah, right up here in the front, this is single tooth right in here. And we've actually been able to replace that with a single mini implant and a crown. Normally you'd have to have either a flipper there, that's what we see with the youngsters playing ball down here, that's what we have to give to them until they get a little older, or something that has to be done as far as a bridge across there. But right there you can see that goes right in, and that has been totally replaced.
There it is, a single tooth. So the only flipper we're going to worry about here in Melbourne, Florida is the animals in the sea, right? Yeah, there you go. So Dr. Apel, let's talk about some of the patients again that come in to see you. We talked a little bit about some of the changes that they've had in their life, but again, talk to us about some of maybe the seniors that come in. What do they experience when they have a denture problem?
Well, it's very frustrating for them, and some of them are embarrassed. They don't want to go without their teeth. You know, to leave them out all night. Sometimes the spouse doesn't even know it. But when they have these issues, it affects basically their lifestyle socially and everything else. A lot of people don't go out. By going through and helping them stabilize that, it pretty much changes their life. They light up when we get that in there, and they're able to smile and do all the activities they used to do.
Because some people who have dentures, I think, just resign themselves to the fact that they're just going to have to deal with the goop and the problems that go with it. And that's so old school, that's all gone.
Yeah.
And they shouldn't be afraid to come in.
Not at all. I had a patient one time, they were out in the ocean and they had dentures. You know what's coming.
Oh no.
They played in the wave, a wave hit them, and the denture popped right out.
Whoa.
It was gone. So those are the kind of situations that we see that we can actually help them.
Yeah, that's interesting that could be an issue. Absolutely, of course. We're in the Atlantic Ocean. Those waves are big. And talk to us about some of the younger patients that have come in, because in Designing Smiles at melbournefloridadental.com, you're changing people's lives to bring back a sense of confidence or instill a sense of confidence they may not have had in the first place.
Yeah. A lot of the kids coming in, you know, whether it's straightening the teeth in adolescence, okay, which we provide. If there's a whitening, sometimes, you know, right before that big day or graduation, those are the kind of things, the services that we help, and it's been real rewarding to see them as they grow and they really take responsibility.
So you've had generations of patients come to see you at your offices on South Babcock.
Yeah, I'm on my third generation as well.
Well, that's great. Well, that's a great testament to you, Dr. Apel, and your team, and you as a dentist here in Melbourne, Florida. And the address again, folks, is 1514 South Babcock Street. So if you've seen our program here and you're thinking the mini dental implant is something you might want to try, you give Dr. Apel and his team a call at 321-233-3360. Did you get your pen and paper? I hope you did. 321-233-3360. Or you can go online, melbournefloridadental.com. Are you on Facebook, Dr. Apel?
Yes, we are.
All right, so you can find Dr. Apel on social media. Thanks for watching Innovations in Health. You are an innovator in health right here in Florida. Thanks for joining us today.
Thank you so much, John.
You're welcome.
Hello, I'm Dr. Victor Apel. Welcome to Designing Smiles, a mini dental implant center of America.
At Designing Smiles, Dr. Apel uses a modern, gentle approach to dentistry. By bringing affordable mini dental implants to Melbourne and the surrounding communities, he's changing the lives of his patients who suffer from loose dentures or missing teeth.
With mini dental implants, you can be you again. Call us today for a free consultation and give us the opportunity to change your life.